واحب اقدم طبعا استاذي الاستاذ الدكتور هاني موافي، استاذ جراحه العظام بجامعه المنصوره، ومؤسس جمعيه جراحه القدم والكاحل ورئيسها ل10 سنوات متتاليه وناشط فيها ورئيسها الشرفي حاليا. دكتور هاني في الحقيقه يعني عطاء كبير في كل مكان بيبقى موجود فيه. هو النهارده يعني احنا اتفقت انا ودكتور هاني لما نتكلم عن الكالكينياس نحاول نغطي كل الاسبكتس بتاعتها. فدكتور هاني ان شاء الله هيكلمكم دلوقتي عن another kind of management وانتم بتطلبوها في البرزنتيشن اللي هو عن طريق الزاروف ميثودز والميني انفيزيف. هيدينا هنت عنها في انتظار البرزنتيشن بتاع الدكتور هاني موافي.
Thank you, Sana, for introduction. Thank you very much. I'm going to speaking about treatment options of fracture calcaneus. The fracture calcaneus or the management of the fracture calcaneus, it is the most debatable part in the orthopedic surgeon. Sometimes we found that non-operative treatment or operative treatment, and everyone support what he said. For example, there is a paper said that there is no significant difference in pain function being improved with under conservative or underwent surgery. And also another says that the open reduction tunnel fixation show a significantly poorer results than those for others orthopedic conditions, and those of the normal population. So I think we found that the calcaneus, it is, I don't know, it has a bad reputation or not, I don't know. For example, this is a multicentric randomized control study by Griffin et al. In 2014 claimed that there is no benefit from open reduction and internal fixation. But actually, I have there is I'm concerned about this paper because there is a mini limitation about how to choose the patients, and also there is a little bit bias of what is called randomized. And the Veltman in 2013 concluded more modern surgical technique and appropriate selection of the patient leading to minimize complications. So you have to find what is the problem. But actually, fracture management of calcaneus, it is, I said that it is an debatable part in surgery. So there is a debate between operative management in all different items, like open reduction internal fixation. There is a debatable issues, and also minimally invasive reduction internal fixation and close reduction external fixation, even the primary open reduction and subtalar arthrodesis. But actually here there's a very interesting paper about published in 2016. This paper reviewed the best evidence of the literature, focusing on the publisher with the last 15 years, and summarized the finding, and also the work wanted to do and workable recommendation. It is concluded that the orthopedic surgeon managing calcaneus feature fracture should be expert knowledge and also surgical expertise and the latest technique to cover all this option. But they actually told that conclude that the orthopedic surgeon have a tailored treatment of the handicap to the individual patient, which is true. And he make an factors for consideration decision making for care, like the patient's factor, as the professor Osama said, if it is there is comorbidity like diabetes, whatever, aging, gender, function demands, smoking, and also soft tissue consideration, which is very important for the open fracture, severe swelling or blistering, and also fracture character, like standard classification, polar classification, intra or extra-articular. And in this paper, it is said to make a management versus factors consideration. And so, which what is the options about it? Is it strongly suggest or no, or it is possible you can do or not. So we are going to open reduction internal fixation. I think after Professor Osama, I couldn't say he covered all aspects of it. So we are going to the mini invasive technique and reduction and internal fixation. But firstly, I would like to deeply thank Professor Ahmed Al-Hawari, my colleague in Mansoura University, which supplied me with some materials about this topics. And firstly, the mini invasive technique has been divided and becoming popular in cases. And we're going to the another types of treatment of minimally invasive reduction, internal fixation. We're going to the closed reduction and external fixation. But before speaking about closed reduction and external fixator, we have there is an important framework like normal anatomy. The calcaneum is essential for normal gait and biomechanics, and three important calcaneal function is like lever arm of gastrocnemius soleus, vertical support of the body weight, and support of lateral column of the foot, which is very important function to the calcaneus. And the author Schwarzman said that the altered biomechanics of calcaneum would increase the chance of the developing arthritis. So severely comminuted calcaneal fracture cause dramatic distortion of hind foot, including cross shortening of the heel and the lateral translation of the tuberosity. However, many authors describe the techniques of indirect function, and most of them say that there is an favorable outcome, but there is some limitation, including the technique, right? Increased operative time, extensive using of key wire, which are leading to risk of tract infection and problematic reduction. So if we have a minimal invasive technique and also rigid fixation and minimal surgical wound, and also capability to restore normal anatomy and shape and length of the calcaneal body. So I think we like that. But actually, we make an effort about address the problems, and also we're using for closing reduction, and we're using Lazarov frame using its principles and techniques. And the frame is consists of, as usual, it's a tibial frame, tibial construct and the foot construct. The tibial construct is applied as usual, or after that, we introduce three wires. The first wire in the calcaneus, which is the biggest fragment in the calcaneus, and the second wire is introducing into the neck of the talus, and the third wire is introducing in the metatarsal. And we put the wires in the ring, in 8-5 rings in the hind foot, around the hind foot, and the other in the around the metatarsal forefoot, and connected with each other with a threaded rope. But the wires of the neck talus is usually attached or applied to the tibial frame, because to be sure that your distraction is only in subtalar, not in the ankle joint. After that, we're beginning to do a distraction is vertically in the long axis to reducing the heights of the calcaneus, and also to make a room in the posterior articular surface. And we're making a distraction, and this distraction along the foot axis. After that, we check with image intensifier, but that is the frame here, and we check the image intensifier, and to know that where we introduce the shunts. After that, we introduce the shunt parallel to the posterior articular surface of the calcaneus, and we like a joystick, and we begin elevated the posterior the articular surface slowly. After that, we connect it to the posterior ring outside, like this. We introduced, presented primary results of close reduction in 2011, and this is was conclusion that the method minimally invasive technique is this method is technique has restored the normal anatomy, shape, length, and also it is successfully useful in the type 4 cinders, and also particularly useful in osteoporotic patients. For example, this case here is a guy about 35 years old. He had a bilateral fracture calcaneus, and we reduce we make as normal here. This is the patient with the frame, and this is after we removed the frame, and the patient follow up. And this is the left side here, and this is the X-ray after removal of the frame. And here the patient is I think the alignment is good. There is no deformity here, and the patient can standing, and also here there is no deformity in the foot. Another example, this is a lady about 22 years old. This patient has bilateral also calcaneal fractures here, and we use the same technique for reductions. And this is a patient after the first, and this is the second foot, and this is a patient, and the ankle movement is good, and also here, but here. And this a man about 35 years old has fracture calcaneus in right side, and we underwent the same techniques here, and the patient after 2 years follow-up here. And if we see this is an X-ray after 13 years follow-up here, and the patient, he only complained from edema, swelling during walking and standing after a period, but there is no pain during walking, and the movement feels free after 13 years. The most complication is the first we faced is necrosis, tissue necrosis here through the entry of the shunt to the calcaneus. And we published here our publication in 2017, which concluded that closed reduction and CAV using laser provide good function outcome, low risk post-operative complication. So we can conclude it. Open reduction has been advocated treatment choice for intra-articular calcaneal fracture. The complication may be occurred as regards the age, the bone quality. And also minimally invasive technique, it is particularly useful for the patient who has an early treated skin who require reduction fixation. Also type 3 and type 4 cinders, close reduction external fixator has satisfactory results. It's useful in osteoporotic patients. Oh, thank you very much.